Have you ever ignored a small health symptom, thinking it's nothing, it will go away? Well, when it comes to prostate cancer, those tiny signs can be the difference between catching it early or far too late. Today, we're breaking down the early warning signs every man must know, clearly, simply, and in a way that could literally save a life. Welcome back to Balanced Motion Health, the channel where we make men's health simple, practical, and life-changing. Prostate cancer is one of the most common cancers in men, but here's the good news. When detected early, the survival rate is extremely high. So in this video, we'll cover the subtle early symptoms men often ignore, why these signs happen, when to see a doctor, and powerful steps to lower your risk. Stay with me. This is information every man, husband, brother, and father needs to hear. Section 1. Understanding your prostate. Before we talk warning signs, let's quickly understand what the prostate does. The prostate is a small gland, about the size of a walnut, located just below the bladder. Its main job is to produce seminal fluid. But here's the tricky part. Because the prostate sits so close to the bladder and urethra, even small changes can affect how you urinate. That's why many early warning signs show up in the bathroom first. Section 2. Early warning sign number 1. Changes in urination. One of the earliest red flags is a noticeable change in your urination pattern. These include needing to pee more often, especially at night, a weak or slow urine stream, a feeling that your bladder isn't fully empty, trouble starting or stopping urination, pain or burning during urination. Now here's the important part. Not all of these signs mean cancer. Many also happen with BPH, enlarged prostate, or infections. But they should never be ignored. Imagine your prostate is like a ring around a pipe. If it grows or becomes irritated, the pipe, your urethra, gets narrowed. That's why the flow changes. If you notice these symptoms happening more frequently or getting worse, take them seriously. Section 3. Early warning sign number 2. Blood in urine or semen. This is one of the clearest warning signs and one of the most often ignored due to embarrassment. Blood appears as pink or red urine, brownish or red-tinged semen. Even a single occurrence is a reason to get checked. Blood happens when cancer or inflammation damages tiny blood vessels in or around the prostate. This symptom does not always mean cancer, but it always means something is wrong. Section 4. Early warning sign number 3. Ejaculation problems. Many men experience changes in sexual function long before they realize it's a prostate problem. These may include erectile dysfunction, ED, that develops gradually, painful ejaculation, reduced ejaculation volume. Why does this happen? Because the prostate plays a major role in producing seminal fluid, and the nerves responsible for erections run very close to it. When something is affecting the gland, inflammation, growth, or cancer, those functions can be affected too. The key is noticing a pattern, not a one-time issue. Section 5. Early warning sign number 4. Pelvic, lower back, or hip pain. This is a more serious sign that cancer may be spreading. Pain may appear in the lower back, the hips, the pelvis, the upper thighs. This isn't the typical muscle pain from working out. It's often a deep, dull, constant ache. Why this area? Because the prostate is located near lymph nodes and bones in the pelvis, cancer cells can spread there, causing discomfort. If this pain doesn't go away or becomes persistent, get checked immediately. Section 6. Early warning sign number 5. Unexplained weight loss or fatigue. This isn't usually an early symptom, but when it appears early, it matters. You may notice feeling tired all the time, losing weight without trying, loss of appetite. These are general symptoms, but when combined with any of the earlier signs, they become much more important. Your body could be using extra energy to fight abnormal cell growth. If you feel off for weeks and can't explain why, listen to your body. Section 7. Who is at higher risk? Not everyone has the same level of risk. Men are at higher risk if they're over 50 years old, they have a family history of prostate cancer, they eat a high-fat diet or are overweight, they are physically inactive, they are African or Afro-Caribbean, higher genetic risk. If you fall into any of these groups, pay extra attention to the signs. Think of it like this. Your risk doesn't mean you will get prostate cancer. It just means you need to be proactive. Section 8. The power of early screening. Here's the truth. Prostate cancer caught early is nearly 100% treatable. How do you detect it early? Through two simple tests. 1. PSA test, blood test. This measures prostate-specific antigen levels. High PSA doesn't always mean cancer, but it means your doctor should investigate further. 2. Digital rectal exam, DRE. A quick physical check to feel for abnormalities. Men aged 45 plus or earlier, if you have risk factors, should talk to a doctor about screening. Don't wait for symptoms. Prostate cancer often grows silently. Taking a PSA test early is not a sign of fear. It is a sign of intelligence. Section 9. Lifestyle habits that reduce your risk. Preventing prostate cancer is not guaranteed, but strong research shows several habits significantly lower risk. Eat prostate-friendly foods. Tomatoes, rich in lycopene. Broccoli, kale, spinach. Nuts and seeds. Salmon and sardines. Green tea. Reduce high-risk foods. Processed meats. Excess sugar. Fried foods. Heavy alcohol use. Exercise 30 minutes daily. Walking, cycling, or strength training improves hormone balance and immunity. Maintain a healthy weight. Fat cells increase inflammation, a major cancer risk factor. Manage stress. Chronic stress weakens immune defenses. Small habits can create massive long-term protection. Section 10. A short story. Why early detection matters. Let me tell you a quick story. A man named Yusuf, 51 years old, noticed he was waking up 3 times a night to urinate. He assumed it was just age. He ignored it. Months later, he felt back pain that just wouldn't go away. When he finally went to a doctor, the cancer had progressed. Compare that to another man, Ahmed, age 48. He noticed his urine flow weakening. Instead of waiting, he booked a simple PSA test. It turned out his prostate was enlarged, but early screening identified abnormal cells extremely early. He received treatment, and today he is healthy, active, and enjoying life with his family. 1 ignored symptom, 1 checkup, 2 completely different outcomes. Section 11. When to see a doctor. Go for a medical check if you notice any change in urination lasting more than 2 to 3 weeks, blood in urine or semen, erectile dysfunction that gradually worsens, pain in the pelvis, hips, or lower back, unexplained weight loss. Remember, seeing a doctor early doesn't mean something is wrong. It means you want to stay healthy. If you watch this far, you clearly care about your health, and that already makes you ahead of most men. Now here's what I want you to do. Check yourself for any of the symptoms we discussed. Book a PSA test if you're over 45 or earlier if you're high risk. Share this video with one friend or family member. This information could save their life. And if you want more videos on men's health, from hormones to sleep to nutrition, hit like, subscribe, and turn on notifications so you never miss our weekly uploads. Your health matters, your life matters, and taking action today is the most powerful step you can take.